Britain has had a national health service for almost 80 years now. It's a long-standing issue. And so all healthcare is basically purchased by the government. And that means that there's only so much money to pay for everybody. And when that amount of money runs out, there's basically no more money for treatment. The things that most people use are actually cheap and free. The problem is if you get seriously ill, if you have a major form of cancer, you don't know until you have that form of cancer that's quite seriously advanced that the cutting edge treatments are just not going to be available. And that's where the government starts trimming and cutting and just not covering things. If you need major surgery, if you need a neurosurgeon, there are just long waiting lists. You could be waiting for the best part of a year for surgery. And it's not like waiting for having a piece of furniture to be delivered. That's a bit annoying. It's a bit of an inconvenience. But if you're waiting for surgery because you have cancer, while you're waiting, which could be months, your condition could be getting worse. You have months of anxiety. You have like serious problems that are going to be occurring because you're unable to work. A waiting list sounds kind of bad in the abstract, but it's a real problem. It's one of the most, it's frankly really cruel to people who are most seriously ill. This treatment, like the financing would be there and they would be willing to pay for it. People are willing to pay more for better access to healthcare. And under single payer systems like Britain, they basically say you're only allowed to get what the government can cover.
Welcome to a brand new episode of the Michele Tafoya podcast. Please hit that subscribe button. You know, we want you to hear every single episode. This one in particular, we're going to talk a little bit about the big, beautiful bill, the one big, beautiful bill, the OBBBBBBBBBBB. We're going to talk about it with Chris Pope at the Manhattan Institute, because a lot of people seem to think that Medicare and Medicaid are going to get cut and the world's coming to an end as it comes to your health care. I think Chris Pope will shed some light on that will be interesting for you to hear. He also talks about socialism in the United States, why it's piquing so many people's interests, and the good and the bad and the ugly. Chris Pope, very smart guy, Manhattan Institute fellow. He was the director of policy research at West Health, which is a nonprofit medical research organization. He has a great resume. Chris, welcome. I want to jump right in with you. You have a vast knowledge of these policies that the average American does not. And I'd love it if you could talk to us like we're second graders when we get into some of these details about the one big, beautiful bill. Democrats love to hate it. Republicans love to love it. Is there some sort of middle ground where each side has a point?
Well, I think the one big, beautiful bill was basically much less of a big deal than it was cracked up to be. I think the biggest part of the bill was just extending the tax cuts. So that was basically keeping things the same. And a lot of the Medicaid cuts sounded like a big deal, but they were really trimming around the edges of the program. And quite frankly, often just slowing the rate of growth of the program rather than taking anything away from anybody.
Yeah. You know what? That's one of my big pet peeves. When either side says they're slashing spending, they're cutting spending, when in fact, very often it's just not increasing spending. And they call those cuts, which to me is so disingenuous. Is that what you're saying about this, that they're slowing growth of these programs rather than getting rid of them? You know, after nearly 30 years on the sidelines, whether it was the NFL or the NBA or the Olympic Games, I've learned that true expertise comes from consistency, not guesswork. So that's why I've partnered with Sports Corner Daily. Their free daily picks keep hitting with analysis so sharp even casual fans can win. Now, the NFL season is well underway. There's no better time to jump in. Get 2 expert picks sent to you every single day, absolutely free. Let me repeat that. Get 2 expert picks sent to you every single day, absolutely free. Just head to sportsdailypick.com and sign up in seconds. No cost, no risk, just smart winning insights. Don't wait. Get into the season the right way. Sportsdailypick.com. Sports Corner, where winners start their day. Again, visit sportsdailypick.com, sportsdailypick.com. When either side says they're slashing spending, they're cutting spending, when in fact, very often it's just not increasing spending, and they call those cuts, which to me is so disingenuous. Is that what you're saying about this, that they're slowing growth of these programs rather than getting rid of them?
That's exactly right. That's really the nature of what happened. And it's a very small difference to the rate of growth. The rate of growth is the big problem with these programs. And this just kind of nibbled at that. It just tweaks at the edges, but didn't really address the core drivers of the program's growth.
And what are those core drivers of the program's growth? Because I think people don't really have a good grasp of that.
Yeah, so Medicaid is really two things. It's a healthcare benefit for poor people, and it's also a way for the federal government to send money to the states. Um, and these two functions aren't always completely aligned. The way it distributes money to the states is that for every dollar that the states spend on healthcare services for beneficiaries, the federal government pitches in between $1 and $9. So this, and that's without limit. So the states are basically able to expand the program as much as they want over time, and the federal government will put up money basically without limit. So it's basically the cost of Medicaid depends on how much states want to spend on it, how much they want to expand it, and some do that way more than others.
I would imagine so. Is it safe to assume that liberal states expand it more than conservative states?
That's a very safe assumption, yeah. New York spends 3 times as much per person on the program as Florida. Um, Over the last 5 years, even the increase in New York's per person spending on the program is more than Florida spends in total. So these are gigantic expansions of the program that we're seeing. And no one really talks about it because it's not happening at the federal level. It's really just the states, when they have more money, when their tax revenues are flush, they expand Medicaid. And this has been the way that the program has really worked for decades now.
Given that, and just the kind of the dismal picture of health in the United States, and this, over here, then we've got Maha, we've got RFK Jr., we've got people wanting to put pressure on on big pharma, on food manufacturing, and all these things. How relevant is that, do you think, to these costs? Because it seems to me like we're unhealthy and we're doing it to ourselves.
Yeah, I mean, I feel like fixing people's diets is easier said than done. Like, we have a lot of people in this country that really want to lose weight and spend many, many years struggling to do it. And that's if they themselves are bought in. If you're losing weight because the government's telling you to lose weight, that's an even more difficult thing to achieve. And people are definitely resistant to that. I mean, we saw during the Obama administration, Michelle Obama had an initiative to get people to lose weight, to eat healthier. We saw when Mike Bloomberg was mayor of New York, he had his war on big gulp sodas. He wanted to ban the supersized sodas. And so other people have tried in the past, really, to try and fix Americans' diets. But, the more aggressive you are in trying to do this, the more pushback you face. I mean, we saw in RFK's confirmation hearings, he talks about how his boss likes Big Macs and sodas, and he doesn't want to take those away. He doesn't want to touch those. So it's really hard to make a lot of progress as a politician on that issue, because you run into resistance pretty quickly. People don't want you telling them what to do with their lives.
What about, the idea that pharmaceutical companies and the advertising, the amount of advertising from big pharma is kind of like, if you pay attention, it's amazing. And this executive order has been signed now by the president that is going to try to ban that. First of all, is that something our Constitution will abide, do you think? And secondly, is that a problem? New Zealand has banned those ads.
Yeah, quite a lot of countries actually don't allow direct-to-consumer drug advertising. There's a long debate about the value of that advertising. I think the industry will say, it lets people know that if they have a serious condition, that there actually is a drug out there that can treat that condition, and it makes patients aware that something can be done. It encourages them to reach out and get treatment when that's available. I do think that's a fair case. Um, but then there are certainly cases in which there are branded drugs and generic drugs that basically do the exact same thing. And in that case, having a patient choose the branded drug over the generic drug, that just adds to the cost. It doesn't really make them any healthier.
Right. So I'm kind of hearing two things here. We've extended the tax cuts, which I think most people like, but there's also the bit about no tax on tips, that whole sort of umbrella of things for good, for working class people. How do you come down on that part of the big beautiful bill? Is that counterproductive?
Well, I mean, it certainly is going to cost the government a lot of revenue, and it's going to have to find that revenue from somewhere else eventually. The question of what you should tax, I mean, like tax policy is very, very complicated. The issue of if you don't tax tips, everyone's going to want to be paid in tips. And so it becomes a big tax loophole for everybody. They've tried to address that, but by basically saying it only applies to people in certain industries. So people in hospitality are going to be able to claim a limited amount of their income as tips. I think it probably isn't going to make that much difference because there's a lot of undeclared income. Like when people are paid cash, often they're not declaring that income to the IRS. And so how much tax would be raised from tips anyway? That's a fair argument, but it's a complicated discussion. Obviously, nobody likes paying tax, but to pay for everything that we want the government to do, the money does have to come from somewhere.
Well, that's a opening a whole can of worms, and I kind of want to dive in a little bit and ask you. We've had people propose flat taxes, simplifying the tax code because the tax code is insanely complex, and it's I don't know how many pages it is, but it's ridiculous. Is there an ideal tax code in your mind?
Well, simpler is definitely better because when you create all kinds of loopholes, it just basically tells every accountant, every tax prep person in the country, go exploit those loopholes.
Yeah.
And it means that if you're someone who's got a really good accountant, you end up paying not many taxes, and the guy that is just an ordinary worker will end up getting clobbered by most of the revenue. We used to have actually a much more complicated tax code than we did currently. And I think that's where the case for the flat tax uh, came in, is that 40 years ago, it was the case that lower income people paid a higher share of their income in tax than rich people because there were all kinds of loopholes for everything from like grazing horses on your property to like growing all kinds of different crops that rich people could take advantage of. People who had capital income found it very easy to avoid taxes. People who were workers found it very hard to avoid taxes. And so there was definitely a push to say, if we just had one flat tax to everybody, it would mean that there would at least be fairness, and rich people wouldn't be able to take advantage of all the deductions. Um, we've done a pretty good job, I think, over the last 40 years since the Reagan administration of reducing the tax burden on ordinary working people, basically trying to shift the tax burden of the rich, not really by increasing taxes on the rich, but basically by cutting taxes on ordinary workers. Much less than they used to be. It used to be that everyone paid about a third of their income in taxes. Now working class people will probably pay like 10-15%. So it'd be substantially lower. We could go further that way. I think that kind of makes sense. Cutting tax rates for ordinary workers is definitely something we should be trying to do. But yeah, having more complexity generally advantages people who can pay for other people to prepare their taxes and have.
Right.
You don't
Pay for
really
that
want half
brilliant
your
accountant.
economy to be geniuses trying to dodge taxes with
Right.
accountants.
Right. And I'm sure accountants would hate to see a flat tax because tax accountants would be like, well,
Yeah.
what do I do? Um, it's quite a big topic. It's one that people use as a cudgel all the time. And that whole, rich should pay their fair share. Are the rich paying their fair share?
Well, I mean, it's tricky to kind of say. I think the basic problem with taxing the rich is that ordinary people work for a company that's in a particular place. If you're a billionaire, basically all your income is capital income. And so if you're, say, Elon Musk, right, you can say, oh, well, my income is actually all going to the Cayman Islands or it's all going to Switzerland. And so it's very, very easy for super, super rich people to shelter their money from taxes by moving their income offshore or by like using all kinds of complicated financial instruments to dodge taxes. Like they can say, this income isn't real income, it's borrowing. There are thousands of different ways for them to hide income. So that it's just really, really challenging to tax someone whose income is basically paper or like basically electronic. It's
Yeah.
almost not real. It can be go into a bank account anywhere in the world. So the issue of fairness almost it's just a technical challenge. How do you get tax revenue from these people in substantial amounts? In terms of average people, you know, most people are average people. They work for a company, they live in a particular place, and they're easier for the government to tax in a way. And
Mm.
so at the end of the day, if the government does very, very expensive things, and we want them to provide very expensive healthcare benefits, we want them to provide retirement benefits, we want them to fund the military and transport and all these things quite rightly. Um, but at the end of the day, there's only so much you can do. You can squeeze out of the rich before they start sheltering their income in tax havens around the
Right.
world.
And that brings me to the second part of our conversation, which is this idea that, was made famous. Socialism doesn't work because eventually you run out of other people's money. And there is this move. We've seen these polls that more and more people think socialism a great idea. Of course, we're going to do it right here in America because it's never worked, but no one's ever done it right. We've got Alexandria Ocasio-Cortez, we've got Bernie Sanders, and now Zoran Mondani is the socialist king of New York. Why does this idea keep percolating, do you think?
Well, I mean, New York City certainly has long been a very left-wing city by national standards. So I think there's always been a constituency in New York City for pretty left-wing politics. So I think in the short run, that's why Mandami has the popularity he has. If he was running nationwide, I mean, that's no question in my mind that he would be very unpopular. And there's,
Yeah.
I think, very little chance that he would win office. And I think every Democrat knows that from a national point of view, being associated with him would be a disaster for the party. But it still is the case that there is a part of the Democratic Party, certainly a substantial part of New York City that is attracted to this. I think ultimately it comes from the fact that New York City has a lot of very, very rich people, a lot of very, very rich businesses with a lot of money, and a lot of people who don't have money, and they feel like they can tap that wealth without scaring it away. That's worked to a certain amount. I mean, we've seen New York City has very, very high taxes, and people do stick around. But at some point, it becomes easy for people to move to Florida or even to
Yeah.
move to New Jersey. And there's really going to be a limit to how much Mandami can get out of this.
Not only that, if you say you want, all this free stuff, free is never free. It's got to be paid for some way, somehow. And I think people seem to think that the government magically comes up with this money, that they don't take it from anyone, when in fact it's the taxpayers' money. So you're seeing this this bubbling up of companies getting a little nervous, I think. And on top of that, this guy, in his infinite wisdom, wants to take a different approach to crime and policing. And let's empty Rikers Island now is his latest bit. I just wonder if New York City has got to hit some sort of rock bottom before people get it. And I'm sure there's someone who would debate me on this and say, but all of these things are possible and we can live in utopia and it'll all be good. I'm not convinced. So if this guy wins, how bad do you think it could get?
Yeah, I mean, from a public safety, law and order point of view, we just came out of a pandemic where it's not like people have forgotten what living with high levels of crime is in New York City. It's not like people haven't experienced this recently. It's very surprising to me that that's not a bigger issue, that people aren't taking it more seriously. We saw in 2024 that Trump won a lot more votes in New York City than he had in 4 or 8 years before then. And I think a big part of that was a real concern with crime. So maybe it's that the people in New York City look at the other candidates and think, well, they're flawed. They don't offer real solutions to this. Maybe it's that people get complacent, or I don't quite understand why it is that people don't take it more seriously in the city.
Like this.
I don't either. And we're kind of in a moment in these past several weeks of some really high profile crimes, not just in New York City, but definitely in New York City. The elderly couple that let in a man to, he wanted to charge his cell phone. He ended up murdering both of them, burning down their house, stealing from them. The atrocity in Charlotte, the shootings in Minneapolis, where I live, all of this stuff seems to be garnering a good amount of attention that you would think voters would say, maybe bad guys really should be behind bars. Maybe the mentally ill really should be locked up in some way, shape, or form, that we're being a little too empathetic. But I mean, in your experience, does it take, as you've just said, New York saw it. We've been through it. We've been through protests. We've been through all these things. And yet here's this guy who doesn't offer a solution except let's empty the prisons. So I'm baffled, and I don't know about you.
Yeah, I mean, I don't think it's that issue that's making him popular in the city. I think his popularity is likely despite his stance on that. I think there are other reasons for his popularity, and ultimately, I think people probably getting a little complacent, or maybe thinking, well, maybe he doesn't really mean it, or maybe there are checks and balances that will stop him from implementing a drastic relaxation of law and order in the city. I don't think there's a great outcry in the city for people wanting to empty the prisons, for instance.
Yeah. But there's those free buses and rent freezes, which, and I'd love it if before we let you go, you can describe to people how rent freezes work and the good, the bad, and the ugly of that suggestion.
Yeah, I mean, so New York City has long had rent control legislation across the city, and there is a limited amount that rent is allowed to increase over time. That works out nicely for people who are in apartments that have rent control, but it has real impacts on people who don't have access to rent control apartments. It very much limits the supply of new apartments. It means that there's less construction. It means that there's less maintenance of buildings. And so it really sort of creates a privileged class of people who are entitled to rent control. And for people who haven't been able to get rent controlled apartments, they're kind of squeezed out and find it very, very difficult to find an affordable place to live. Now, the idea of creating a rent freeze, or kind of further cutting what landlords are able to get from rent, that's obviously very appealing to people, to many millions of people potentially who think that they're going to get a windfall in the short run. Whether that's actually going to play out, I'm skeptical that that's likely to happen. And also, I think you're likely to see quite substantial pushback.
As you said, if there are rent freezes and you have a building that requires a certain amount of maintenance and you can't pay for it, that doesn't really help anybody. So it's some basic stuff. I think a lot of this stuff that we're talking about is pretty complex, Chris, but a lot of it is also very simple, I think. And it's the simple stuff that people need to remember. And, as they vote and think about socialism in their future. I lied. I have one more question for you. Socialized medicine. I was just recently in the UK. I know that's a big thing over there, but I don't see the benefit of it. I see it hurting medicine in the United States in a massive way if it is socialized. Am I wrong?
Yeah, I mean, Britain has had a national health service for almost 80 years now. It's a long-standing issue. And so I think that the core element of it is that all healthcare is basically purchased by the government. And that means that there's only so much money to pay for everybody. And when that amount of money runs out, there's basically no more money for treatment. What tends to happen is the government thinks, well, most people are healthy. What healthcare do most people use? Well, they probably use a little primary care. They have low acuity needs. And so primary care is cheaply accessible. Like saying like 80% of people don't go to the hospital in any particular year. And so the things that most people use are actually cheap and free. The problem is if you get seriously ill, if you have a major form of cancer, you don't know until you have that form of cancer that's quite seriously advanced that the cutting edge treatments are just not going to be available. And that's where the government starts trimming and cutting and just not covering things. If you need major surgery, if you need a neurosurgeon, there are just long waiting lists. You could be waiting for the best part of a year for surgery. And it's not like waiting for having a piece of furniture to be delivered. That's a bit annoying. It's a bit of an inconvenience. But if you're waiting for surgery because you have cancer, while you're waiting, which could be months, your condition could be getting worse. You have months of anxiety. You have like serious problems that are going to be occurring because you're unable to work. It's quite a different situation. And so a waiting list sounds kind of bad in the abstract, but it's a real problem. It's one of the most, it's frankly really cruel to people who are most seriously ill, who in in a different system of payment would be able to access treatment. Like the financing would be there and they would be willing to pay for it. People are willing to pay more for better access to healthcare. And under single payer systems like Britain, they basically say you're only allowed to get what the government can cover.
Hate that idea. Absolutely hate that idea in the strongest terms. And I'm glad you put it in a way that is so simple for us to understand. It's real stuff. Chris Pope for the Manhattan Institute, we so appreciate your taking the time today. And I end every podcast by saying, be brave and do good. Read his stuff. Have the guts to really look at these problems and turn it into some good decision making. Thank you, Chris.
It's great to speak with you.
Hey, you can keep up with the Trump administration when you subscribe to the Trump Report. It's an email that brings you daily highlights from the Oval Office right to your inbox 5 days a week. Subscribe today at SalemPodcastNetwork.com/Trump.